Welcome to Florida Keys Community College. We're going to simulate a medication competency for you today. I'm going to be administering one PO medication. The first thing I'm going to do, of course, is I'm going to simulate washing my hands for 10 to 15 seconds. After I wash my hands for 10 to 15 seconds, I'm going to come over to my med cart and I'm going to review my chart. The first thing I do when I review my chart is check the physician's orders. I'm going to read them completely. After I read my physician's orders, I'm going to go over to my medication administration record, and I'm going to check the medications that are ordered against the medication administration record and make sure that they're all correct. I want to make sure the patient's name is here. I want to make sure that there's a second identifier in the form of a date of birth. I want to make sure that the medication, the dose, the time, and the route are correct, which they are. And I also want to make sure that there's a notation that says what the patient's allergies are. And here it says that the patient has no known allergies. I'm going to check that a second time with the patient, but I want to make sure that I know what to expect going in. Now, my medication administration record and orders say that my patient is going to get a medication called digoxin, 0.25 milligrams PO daily at 9 a.m. It's now 9 a.m. on our clock. Before I can administer a medication, I want to check and make sure that the medication is appropriate or matches the client's medical history or condition. So I'm going to look at the history and physical and see if I can get any clues from that. When I look at this patient's history and physical, I see that this patient is a 68-year-old female, so she's considered geriatric. I see that her name matches the medication administration record. I see that her weight is 54.5 kilograms. Again, she has no known allergies. I see who my attending physician is, Dr. Juan Gonzalez. I'll call him if I have any problems or issues or questions. And I see that she has a medical history of congestive heart failure, hypertension, and a hysterectomy. She fell at home on her left hip after becoming dizzy in the shower, so that's a consideration as far as her activity goes. And she is a retired daycare provider, so she should be literate and able to answer any questions or inquiries that I might have for her. It says here in her physical assessment performed by the physician that her heart has normal S1 and S2 sounds with no murmur. Her typical rate is 64 and she has a regular rhythm. So yes, I would say that the medication digoxin matches her medical history. Alright, the second thing I'm going to do is check any vital sign trends and lab values as appropriate. I look on my drug card and I see that with digoxin there's a toxic and a therapeutic level. So I am concerned enough to take a look at her lab values and see if there's been a digoxin level checked any time in the recent past. So when I look at her lab values, I see that her digoxin level is within normal limits. It's 1.2 and the reference interval is 0.7 to 2 nanograms per milliliter. So it is appropriate for me to give this patient digoxin. Another consideration that I see on the drug card is that there is a pre-assessment or a pre-administration nursing assessment that needs to be done. In the drug book it says that you need to assess the apical pulse for 60 seconds. If the pulse is 60 or less, withhold the drug and call the doctor. So I want to make sure that I perform this assessment before I administer the medication. I'm going to bring my stethoscope with me and I'm going to put this medication separate from any other medications that I'm going to administer to remind myself to do that. Another thing that I want to do before I administer any medications is I want to identify any special considerations. If I need to crush the medication, that needs to be looked up, or I need to call the pharmacy. If the drug needs to be given on an empty stomach or with food, I need to also call the pharmacy or look up in the drug book to see whether that can be done. All right, now I'm ready to prepare the medication. I've reconciled my MAR with the physician's orders. I've checked my dose. It looks right. I've looked up all the nursing considerations, the class, the therapeutic effects, whether the route and the dose are appropriate, what it's used for, contraindications, and there aren't any for this patient, interactions, and adverse reactions on this patient. And one adverse reaction that I want to note that I would watch for, and I'll do some teaching with the patient, are neurological disturbances, including facial pain, ocular disturbances, or GI disturbances. All right, so now I'm going to do my first check. I'm going to take the medication out of my cart, and I'm looking for digoxin 0.25 milligrams. So this is my first check, and I'm looking at this, and it says digoxin 0.25 milligrams, and this says digoxin 0.25 milligrams PO. Okay, I'm going to close this. I'm going to leave the medication in the unit dose wrapper. I'm going to put the medication right in front of the medication administration cup, and I'm going to do my second check with my medication administration record, and I'm going to say this is digoxin 0.25 milligrams PO. Another thing that we always look for on medications is to make sure that the wrapper is intact, that it has integrity, that it's not crushed or broken, and also that the expiration date is it's not expired, the expiration date is okay. If it were expired or there was any problems with the medication, what we would do is we would discard this drug and we would start over. But it's not, so we can go ahead and give it. All right, at this point, I'm ready to go over to the patient. So I'm going to stay with my drug cart. I'm not going to leave my medication, but I'm going to wash my hands again for 10 to 15 seconds. And we can verbalize that. You don't actually have to walk over to the sink. And I'm going to bring my medication administration record with me over to the patient, along with my drug card and my drugs. Knock, knock. Good morning, Miss Franklin.
Good morning.
This is Sherry, a registered nurse. I'm here to give you your morning medications.
Oh, okay.
All right. How are you feeling today?
Pretty good.
Pretty good. I'm going to put the head of your bed up, if you don't mind.
All right.
That's going to make it easier for you to swallow the medication. Have you had any problems swallowing?
No.
Okay, so you ate breakfast?
Yes, I did.
All right, and everything went down just fine. That's excellent. The first thing I want to do while I'm in here is I want to do a quick survey of my patient. Of course, airway, breathing, circulation. Is everything fine with her? She spoke with me. She talked about her breakfast. She said she's not having any problem swallowing. So that was my quick survey. I'm going to make sure that I have the right patient. So I'm going to check the patient against the medication administration record. And I see here, can you tell me your name and date of birth?
Urethra Franklin, February 14th, 1941.
Okay, excellent. And that name and date of birth matches what I have here on the medication administration record. All right, right now I'm going to pause before I go any further. I want to make sure that I verbalize to my instructor what my 6 rights are. I want to make sure that I have the right patient, which I do. It's Miss Urethra Franklin, and I check that against the medication administration record. I want to make sure I have the right time, which I do. It's 9 a.m., and typically we can give a drug half an hour before or half an hour after the time that it's ordered. I want to make sure I have the right drug. And we do. We have digoxin 0.25 milligrams. I want to make sure we have the right route, and we do. It's PO, and this is a tablet, which will be given PO. And I want to make sure that we do the correct documentation, but we'll do that after we complete administering the medication to Ms. Franklin. We don't ever document prior to administering medications. I'm going to don my gloves. And if you remember on our drug card, it told us that what? We need to do a pre-administration assessment on this patient. It's very important because digoxin can lower the heart rate. We found out when we looked it up in the drug book. And if this patient has a heart rate, an apical pulse below 60, we're going to want to withhold the medication and call the physician. This is also a great time to do some patient teaching. Mrs. Franklin, have you been on digoxin for a long period of time?
Yes, I have.
So you know that you need to check your apical pulse for 1 minute before you take your medication, right?
Yes.
Okay, well, I'm going to check your apical pulse for you today. Okay, it's been 1 minute, and Mrs. Franklin's apical pulse is 64. Another thing that I want to check while I'm here are her vital signs for any trends. And her vital signs are within normal limits. The tech also got 64 when she took her vital signs. So I'm getting ready to administer this medication. So Mrs. Franklin, do you know what the digoxin is for?
Yes, I do.
You do? Can you tell me what it's for, just to make sure that you and I are on the same page with this?
Well, the doctor calls it my heart vitamin.
Excellent. So you know that this helps to regulate the rate and rhythm of your heart. Okay. And you know that any of the side effects of digoxin?
I think it makes my heart beat a little slower.
Exactly, that can happen. So that's why it's very important for you to check your pulse before you take your digoxin, and also call your physician if you notice any variations in your heart rate. Another thing that you might want to look out for, Mrs. Franklin, are any side effects such as problems with your stomach or problems with your vision. You would want to call your doctor and report those.
Okay.
Okay, great. Here's your medication. Would you like me to put it in your mouth?
Thank you.
There we go. And I'm simulating a glass of water. And she's swallowing it. Can you show me your tongue? She sticks out her tongue, and she's not pocketed the medication. She swallowed it. I'm putting the side rails up. There's no side rails on her bed right now, but you can imagine that there are. Mrs. Franklin, I'm going to be back in to check on you in about 15 to 30 minutes. If you have any problems, or you have any questions, or you're not feeling well, please give me a call. You've got your call light right here.
Okay, thank you.
I'm going to do my documentation right now on my medication administration record. I'm going to document with my initials that the medication was administered at 9 a.m. I'm also going to document that her apical pulse was 64, and I'm going to write my initials and signature. When I leave the room, I'm going to make sure that she has a means to summon help, which she does, the call light, and I'm also going to make sure that she knows that she can call me anytime she feels like it if she has any side effects, questions, or concerns. I'm going to wash my hands for 10 to 15 seconds, and I'm going to make sure that I go back in the room and check on Mrs. Franklin in 15 to 30 minutes. Thank you for watching, and I wish you all the luck in the world on your medication competency.